fight to my very last breath.
I went from being a hopeless dope addict to a dopeless hope addict.
Myself, I'm also in recovery.
I am a recovering long-term person in recovery. April will be 23 years for me.
We all know how dangerous fentanyl can be. It is single-handedly making the opioid crisis in our country even worse. But new data from the CDC shows that more black people are dying of fentanyl at a higher rate in recent years than ever before. So we wanted to know why. And finding an answer isn't so black and white.
Fentanyl is almost like an epidemic within an epidemic. So you've had the opioid crisis that's been kind of sweeping across the country. Now fentanyl is being introduced into that drug supply.
Thanks, guys, for being a part of this. I think it is a conversation that needs to be had. Why do you think we're seeing this in the black community?
Fentanyl is making its way into more of these urban areas where you have higher concentrations of African Americans. And those people have been using heroin for decades, almost safely or in a controlled way, if you will. So now fentanyl is being introduced, and those people are unaware of the potency and the unpredictable nature of fentanyl.
When we talk about urban versus rural, when we think about the rural area, we're, quote, thinking about the Caucasian community, but we're eliminating that there are African Americans as well in those small communities. But in those areas, typically there are African American people using not only the methamphetamines as well as the opiate prescriptions.
Certain cultures like to get high certain kinds of ways, and pills have always been, from my own personal knowledge, pills were for white boys and white girls. You know, pills, black kids, I know when I was coming up, is like, no, you don't do no pills. You do a pill, you can die instantly. So we didn't do pills. So we went to the alcohol and marijuana, and then eventually graduated to the pills and the heroin and all this other stuff.
Fentanyl is not only going to the heroin class, we're now seeing it in the methamphetamines, as well as people are spiking the marijuana as well. So fentanyl is being spreaded amongst all trends of drugs right now.
I read some research that showed that doctors were a lot less likely to prescribe opiates to African Americans than they would to white Americans, simply because they just let them suffer. And so that was a blessing and a curse, sort of a way.
Because they didn't have access to health care, their pain is often dismissed or not regarded at the same level as their white counterparts. So African Americans almost the opioid epidemic bypassed us on the front end. And it's only now on the back end that we're catching up.
I think it's very interesting listening to what everybody says, because I look at this whole epidemic as being green. I don't look at it as being black or white. It's about money. When they opened up all these pain clinics, it became level for everybody, black, white, rich, poor. These pain clinics, they gave out all these pain pills to all these people. You had people like my son, who was a great kid, but you know, hey, it was easy, like they said, to pop a pill. My son grew up in the suburbs. Sherry and I, we grew up in the same hometown and in the same hood. And I said, well, you know, I wanted to raise my kids in the suburbs wanted to give them a better opportunity. And what I ended up finding out is that they do the same thing in the suburbs that they do in the hood. They just do it in a different kind of way.
To me, it seems as if there's just one echoing theme in each community, and that question is, who can stop the pain? So it's a green issue, it's certainly money motivated, but also it's just that hurting that's happening, that when these individuals, young people, or the young at heart, they're just isolated. They want to know who can stop the pain when they've been emotionally, physically abused.
When you take a 21-year-old kid, a 17-year-old kid that gets wrapped up in this, they have no idea what to do. They don't know start and stop.
Some kids, for the first time they try heroin, they overdose. The first time, and some of them die.
Were any of you startled or even surprised by the spike?
I was saddened by it. I realized that I have been in denial about it.
Why do you think you were in denial beforehand?
I was just hoping it wouldn't hit the African American community. With the crack epidemic, that just tore our community apart, and our community was targeted.
We didn't see as much with the crack addiction as we do with the opiate addiction. All people were on crack, right? All people are on opiates, but we didn't have as many deaths.
And you guys mentioned the crack epidemic. How did that play? Did that play any role into the cultural mindset in the Black community?
The crack epidemic and addiction brought about a stigma of mistrust. Now, for me, I could go into a job interview, and because I had a past of addiction and crack, I couldn't become employed. And so people from the outside don't believe that we can recover. And I stand before you today that we can, with the right resources and the help.
Just the way crack addicts were treated in treatment centers. They were treated differently than cocaine addicts who snorted cocaine. And usually the ones who were smoking crack or cocaine, they usually had less money, less insurance, maybe were there on scholarship or whatever. And, you know, at first the powder cocaine was a rich man's drug. And then we saw the disparity in the legal system.
When we had the crack epidemic, you know, we incarcerated a generation of people.
Yes.
They were literally locked away, thrown away. There was no mercy. They got a war on drugs. Now that the opioid epidemic has hit and the demographic looks a little different, you know, we're treating it as a disease. Thank God we are. But for those people in the crack epidemic, they were shown no mercy. Thankfully, the attitudes around addiction are finally changing, but in large part, that again has that racial overtone now that the people who are addicted look like lawmakers in Washington.
Do you think in the Black community there is a stigma or refusal to get that treatment? African
Americans tend to try to treat ourselves. We're strong. We come from a strong background. You know, our mothers worked hard and toted us on our backs. And so we look at a self-sustainable, I can do this.
Culturally, we're told to pray about it or just handle it. And there's a big stigma if the person is crazy or these type things. So we're much less likely to seek mental health for depression and different things like that. And we're distrusting, perhaps, culturally of the medical community because of our history as a people with doctors in the medical community.
We tend to want to care for ourselves. One is because we think we can't afford the treatment that is needed. There's a stigma, there's barriers.
How do you break down the barriers?
We need to educate our doctors. We need to educate our government. Those are some of the bigger barriers that affect the ground level communities. And if we're just dumping money in a pool and say, go do this, are we really being effective?
We have to be progressive in changing the narrative. We have to change the narrative. What do I mean by that? We as a community, we're always out front as it pertains to athletics, entertainment, right? Now we need to be outspoken and lead the way as it pertains to self-care in our community. What does that look like? Well, it would look like it's okay to say, I need help. Just that alone, I need help. If we can make that, you know, the next cool thing to say, you know, it's okay. It's no knock against your womanhood. It's no knock against your manhood to say I'm in trouble and I need help. And I think that would be a great way to start breaking down the barriers.
We need long-term continuum care for the opiate users. It takes time to heal from these opiates, as well as when we were on crack, we could recover. But the opiate, it's causing a lot of mental illness. You may not have had mental illness when you started with this drug and you became addicted, but coming off of it, we are seeing more cases of mental illness. And I just don't think that from where I work and what we've seen is you can't treat one without the other. They both have to be treated simultaneously. People of faith look to help and heal. Well, I don't think they're effective as much as they can be, because if I don't believe in your religion or your faith, then God's going to punish me. But if the faith community, the religious community, could meet people where they are and not demand that they believe in what they believe in, I think we'll have more people in the church opposed to outside the church.
Is there any message to people in the community moving forward, as what it seems like the opioid crisis is just getting worse now that fentanyl is in the picture?
Families don't think it can happen to them. It can happen to anybody. It can happen to the children. It can happen to the parents. Just know it can happen to anybody.
I think we need to reach out to one another more. We need to be connected.
There is hope. No matter how many times you may have messed up or fallen off the wagon per se or relapsed, you can get back up. And there's people that care about you, that have resources, that want to see you well.
Ladies and gentlemen, thank you so much for helping us do this. I really do appreciate it.
Thank you, Matthew.